With that, let me turn to my good friend from Oklahoma, the ranking member of the committee, Congressman Tom Cole, for any opening remarks that he may have.
Thank you very much, Madam Chairman. And just before my remarks, a quick housekeeping piece of advice to you as you preside over. I may have to leave at some point because of my duties on rules, so I might not be here at the end, but I certainly am going to stay for as much as possible. Madam Chair, the United States investments in biomedical research and medical countermeasures have paved the way for the fastest vaccine ever developed in our nation's history. These strategic investments, led with federal support, have also enabled the U.S. to lead the world in vaccine availability. As the President has said, anyone who wants a shot can get one. That's a remarkable achievement, and we are fortunate to be in such a position. I want to thank the thousands of government and private sector employees who work tirelessly to make this reality. Operation Warp Speed, in my mind, remains one of the most undervalued achievements of the last administration. And I want to associate myself, Madam Chair, with your remarks about the role our country is playing in trying to help other less fortunately situated countries get the vaccine as rapidly as possible. I think those are worthy goals and important questions need to be raised and answered. And I know we're here today to discuss the United States, what the United States government can do to bolster global supply of coronavirus vaccines. But before we delve into that topic, I want to spend a few minutes on a fact that I find deeply troubling. The Build Back Better legislation introduced in the House contains just $3 billion for pandemic preparedness. That's less than 0.2% of the total. Let's pause and think about that. Nearly $2 trillion in spending and just 1.7%, that is just less than 1/5% is dedicated to preparing for the next pandemic. Of that amount, less than half is dedicated to funding for public health and preparedness research, development, and countermeasures capacity. Such a de minimis amount dedicated to so critical a function should be unacceptable to everyone. I've said multiple times that you're far more likely to die from a pandemic than a terrorist attack, and sadly, the results of the last 2 years have shown how devastatingly true that is. I would hope the majority's flagship effort to build a better tomorrow after a global pandemic that shook the world would recognize the need to invest in a substantial way in biomedical and biodefense research enterprise. I find this omission another sign of short-sightedness that we see throughout the legislation with short-term extensions and unreasonable policies that most Americans do not support. I also want to acknowledge, however, that the chair's mark contains 6 times as much funding compared to the Build Back Better bill, and that's with nearly 7 times less money. Now, while I still believe we need to invest more in biodefense infrastructure, I am pleased to see the levels proposed in the chair's fiscal year 2022 appropriations for this subcommittee. I know our chair strongly supports access to child care, improving our nation's schools, and paving a way to affordable higher education for all children. She also recognizes, in addition to human infrastructure investments, that we cannot neglect the biomedical and biodefense infrastructure. She supported these programs in her mark, and I hope she sustains that level of support going forward. We have always found these areas of agreement to serve as the basis for our partnership for 6 years running. I also want to recognize that in her annual funding bill, she's proposing nearly the same amount of funding as what was put forward in the Build Back Better bill, which covers up to 10 years. I think this fact shows this subcommittee, possibly more than any other, understands how important these programs are. Underinvestment here ensures the nation will be less prepared for the next outbreak. I led with the importance of the continuing investment in biomedical research and programs like BARDA because it was past funding that enabled the United States to be the current leader by far in global COVID vaccination donations. The U.S. has donated and delivered more than 235 million doses of COVID vaccines to more than 100 countries. And I'm pleased at the even more aggressive plans that the administration has unveiled in recent days. In addition to efforts by the federal government, vaccine manufacturers have also made commitments to increase production and availability to ensure vaccination becomes a global reality. As proud as I am of our nation leading the way, the United States should not have the sole responsibility for vaccinating the global population. It's a shared problem and a shared responsibility. In addition, in my opinion, the Department of Health and Human Services should not be responsible for vaccinations abroad. I understand the agency may have a supporting role to the Department of State and USAID, but events over the last 18 months have shown that we have enough challenges domestically for HHS to focus on. It should not try to achieve objectives beyond its responsibility and capability. I'd like to end by noting that now is the time for us to be looking at opportunities for the next generation vaccine technology, development of new therapeutics, and more affordable diagnostics. I know some of those efforts are underway, but too much focus has been given to the continuing of the status quo. If we continue that approach, we will not achieve global vaccination for years to come. We need to look to new technologies to achieve our goal and should not be neglecting those investments now. I also think we need to expand our focus to future threats. Now is the best time to leverage what we've learned about COVID to begin research into new countermeasures and potential pathogens. We know that the devastation that can be caused by a new virus. We need to do a better job to identify future threats on the horizon and work on mitigation now. Waiting for the next virus to strike and hoping it's far into the future is foolish. The more we shortchange our preparedness today, the less prepared we are when what may be just around the corner. I want to thank our witnesses for their time today. I look forward very much to their testimony. For that, Madam Chair, I yield back my time.